For today, we're going to be doing a skill review on adult defibrillation using the Zoll X Series monitor and CPR stat pads. Remember when applying the pads to follow the manufacturer's recommended placement, unless your EMS system provides you with other instructions. When we're defibrillating, we're going to be looking for primarily two rhythms. We're going to be looking for pulseless VTach, like you see on the monitor right now. We're also going to be looking for Vfib, which you see on the monitor now, and this is more of a fine Vfib. And Vfib can also have a little bit bigger amplitude and look more coarse, like this. When placing the pads, we recommend separating the CPR feedback puck so you can place it in the position where you do correct CPR. Demonstrated in front of you is the anterolateral traditional placement. An alternate placement is going to be the anterior-posterior placement. For this placement, the pad that traditionally goes below the left pectoral or left mammary is going to go in its normal place. The pad that we normally place on the right anterior chest is going to actually go on the posterior side of the patient, below the left scapula or left shoulder blade. Really quick, I wanted to talk about pad placement. A lot of EMS systems have been asking their providers to switch to anterior-posterior. The reason for this is because there have been multiple studies that showed patients with out-of-hospital cardiac arrest in Vfib or pulseless VTach have a greater incidence of ROSC with anterior-posterior placement versus the traditional anterior-lateral placement. When performing defibrillation, you're going to want to immediately perform a primary assessment checking that your patient is apneic and pulseless. Immediately start CPR. Turn the monitor on right away. The monitor has to run through a pretest to get ready to work. You're going to want to place the pads with the manufacturer or EMS system's recommendation. Once the monitor is on, you're going to want to make sure that you're in the correct view, so make sure it says pads in the top right corner. Now your partner is going to be performing CPR, so you're going to see compression artifact on the monitor. We're going to want to get the monitor ready for use, so we're going to pre-charge it using an appropriate joule setting. And again, use your manufacturer's recommended settings or your system's recommended settings. Once you've selected your energy, press the charge button to prepare the monitor. Remember, CPR is continuing while you pre-charge the monitor. Once the monitor is pre-charged, you're going to want to clear all the providers from the patient, making sure that nobody is on the patient and there's no combustible sources. Check the rhythm on the screen for no more than 10 seconds. This is Vfib. We're going to defibrillate, and immediately after defibrillation, resume CPR. Really quick, I wanted to talk about energy settings for defibrillation. You're always going to want to follow the manufacturer or EMS system's recommendations. However, there is an adjustment that the monitor makes when we deliver electricity. For this, we're going to set our joule settings to 200 joules and charge the monitor. Now, after we press shock, I want you to watch the bottom left-hand corner of the monitor. And it says we deliver 250 joules. The reason for this is because there's a computer chip inside the monitor that actually measures the impedance or how electricity is best delivered to a patient, and it adjusts the energy settings for that. One last thing I want to review with you is how to disarm the monitor once it's charged. You should always pre-charge your monitor before rhythm checks to the manufacturer or system's recommended settings. Here we're going to pre-charge to 200 joules before assessing the patient. Make sure that you clear the patient from providers and any kind of combustible sources. Once the monitor is charged and we clear everybody, we see an organized rhythm which we don't need to defibrillate. To disarm the electricity, press the soft key next to the disarm button on the left side of the monitor. That's it for today's skill review. Please make sure you guys click like and subscribe to the link.